Leukemic fever. How would you classify or identify fever due to leukemia? The unexplained, persistent, and recurrent fever. You see the throat, no infection, no, especially in children, and you see count the respiratory rate and your respiratory other symptoms, cough and others, just nothing. So it is not the. It is one of the clue. It is not the simple virus that's or the bacterial infection in the throat and chest. One of the other one is the pallor will be over here will be moderately significant. Usually moderate to severe pallor is there, and then fever in leukemia is due to inflammatory fever. At times it is secondary infection, so you will have the can have these things, and your leukemia, lymphoma, and other cell lines have their other infective other features like the marrow infiltration. Bone marrow when it is infiltrated, you have the marrow failure, you have the the neutropenia and thrombocytopenia. So you will have infection, you will have the bleeding from other sides, like from the epistaxis, from the throat, from the other roots of the skin. So and then at times a little bit of night dancing sort of sweating pattern is possible, and painless lymph nodes in the axillary glands, cervical glands, inguinal glands, and other sites possible. And at times, leukemic infiltration in the bone and the joint can cause arthritis and bony tenderness. So, in the 700 cases, you may have hepatosplenomegaly, you may have unexplained loss of fever, appetite. So, fever with leukemia has these are the cardinal criteria. So, the no fee infection, severe pallor, your significant lymphadenitis and hepatosplenomegaly, and in the bleeding manifestations. Maybe there may be bone tenderness in 30% of cases. So send these children for the CBC PBF and bone marrow aspiration finally if it is suggestive, and immunophenotyping. Refer to specialist center and person.